and I really appreciate the opportunity to present here again to this group. I love these this venue that Jacqueline has set up. She brings in a really interesting, diverse crowd from folks who are making wearables like myself to the natural burial person, which is like some a very different part of the spectrum, but really cool stuff. So let me get my screen going here. Good for everybody. All righty. I'm Doug Franklin, co-founder and CEO of Airhounds. Airhounds enables you to make informed decisions about your risk of exposure to airborne disease like COVID-19 and influenza. I'd like this to be more of a conversation than a lecture, so feel free to lob questions in when they occur to you. Odds are good, you're not the only one thinking of it. That's been my experience anyway. If I've got a dumb question, odds are good, everybody's got the same question in their mind. So state of play. I think it's important to call out that in this country alone, the death toll from COVID-19 is approaching 1 million people. It's just a boggling number. For those, 1 million people on average of 9 loved ones are grieving. That's 9 million people who are grieving for the deaths of their parents, children. Another 16 million remain medically vulnerable to severe infection. And against this backdrop, we've reached kind of a vaccination stalemate. The people who are going to get vaccinated have gotten vaccinated, and the people who aren't won't. Our public response, health response is ramping down at this point in time. We're being told by the administration that it's pretty much up to each of us to make our own risk assessments and do what we think is best. So that's what we're going to focus on today. How can we make good decisions about our risk, and what can we do to mitigate it? I'm going to start with some background about COVID-19 just to set the stage. This might be old material to you guys, so apologies, but one of the tragedies of the pandemic was the early and persistent misunderstanding that COVID-19 was transmitted by droplets. This led to a lot of hygiene theater. I think of it with, plastic barriers and stuff, cloth masks, that kind of thing. It really are quite ineffective against a disease that is transmitted by aerosols, which are tiny invisible particles that we exhale. Aerosols can hang in the air for hours like cigarette smoke. It's just a very different mechanism than our early understanding, which persisted for more than a year. So given that backdrop, the good news is that there are some simple and effective non-pharmaceutical interventions that can dramatically reduce the viral load that we absorb when we're around other people. Real simple stuff, N95 masks, filtration, ventilation, and UV sterilization. We'll hit these along the way in a little more depth, starting with masks. So I love this graphic or this chart because it really highlights the differences between different kinds of masks. So you are that yellow row. You're the person in yellow, and the vertical row is your single source of infection that you are in proximity to. If neither of you are wearing a mask, you got 15 minutes before you're likely to have received an infectious dose. If you're wearing a cloth mask, 20 minutes, so an extra 5 minutes. If you're wearing a surgical mask, 30 minutes, so an extra 15 minutes. If you're wearing sort of a standard off-the-shelf N95, you've got 2.5 hours. If you're wearing a fitted N95, especially one with an elastomer seal, you're up to 25 hours. You could hang out all day and not get ill. So it's a huge difference in mask effectiveness. And I think, again, this crowd probably knows this already, but every time I get on an airplane and see a bunch of people, or used to see a bunch of people with cloth masks, it's like, it's not really doing much, right? It's an extra 5 minutes. Air filters are essentially like masks for your home or business. They do the same thing. They mechanically filter aerosols out of the air. But a good high throughput HEPA grade filter, which is what you need, costs upwards of $800. And for a lot of us, that's a lot of money. If your average school teacher isn't going to be able to put one in her classroom. So here's an alternative for folks who are looking for something that they can do to pull the virus out of their indoor air. It's called a Corsey Rosenthal filter box. Less than $100 to put together with materials you can purchase locally. This website that I cite, cleanaircrew.org, is absolutely awesome. It is just a great resource. They have comprehensive instructions on putting these things together. I've built two. Took me about maybe an hour and a half on the first one and maybe 30 minutes on the second one, because of course you know what you're doing. But well worth going out and doing it yourself if that $800 is just too high of a hurdle. A cautionary note about HEPA filtration in regards to airliners. Airlines tell us that their air is great, but for the 30 or 40 minutes you're in your seat waiting for your plane to push back from the gate, you're rebreathing air from other passengers. This is a picture I took on board an Alaska Airlines flight from Seattle to Anchorage back in January. That's nearly 3,000 parts per million CO2, which means that you're breathing about, I think that'd be about 7% somebody else's air in your lungs. The onboard HEPA filtration on airplanes, it doesn't kick in until the engines or APUs are running. So airlines can fix this. All they have to do is fire up their APUs, although that does cost jet fuel, or hook their airplanes up to the jet bridge ventilation system. So they have the tools in hand. Most don't bother to do so. However, I've been dinging Alaska Airlines on Twitter every time I fly, so I'm that guy. And I at them on Twitter and post their CO2 readings. And when I was coming back from Seattle a week ago, the pilot came on after we'd sat at the gate for 30, 40 minutes, something like that, and apologized for the bad air quality. It was running about 3,300, I think. And he fired up the APU. So maybe they're listening. I think it's encouraging. It's encouraging that they're actually starting to be cognizant that while they are saving some money by not firing up the auxiliary power units, it does have a toll, right? So I thought that was an interesting side note. Any questions on airplanes? Is it near and dear to anybody's heart? So let's talk about ventilation. A study conducted in Italy in January of 22 showed an 82% reduction of infection in schools with good ventilation, 82%. It makes a huge difference. In their case, they were doing mechanical ventilation, so they had, a system that was actually pulling in fresh air and pushing out the stale air. So that's kind of as good as it gets in terms of how ventilation works, but it's just a super simple idea. I mean, you're just trying to reduce the load of aerosols, which is shown in this graphic by the little blue dots, in your house or your business by forcing them outside and replacing them with fresh air. It's just the simplest thing you can do. Florence Nightingale started this back in like World War I-ish. Turns out she was right. A couple tips for Alaskans specifically. If you're having people over in your home, and as we did this Thanksgiving, put a box fan blowing outwards through an open window, and it will vent out the stale air in your house, which then gets pulled in from under the door or wherever it comes from in your home, without letting as much cold air in, because you're venting warm air and then pulling the rest in through your natural pathways. Another cool thing you can do that you wouldn't think was, I didn't think it was a thing. If you have a fireplace, get a nice fire going. The convection will pull all of your stale indoor airs up through the fireplace, out the chimney, and then again, you're going to have fresh air coming in through whatever leaks you have in your house, whatever those pathways are. In my house, it's virtually the entire house. So, because it's from 1950. Any questions on ventilation? Thoughts? Cool. Cautionary tale. So kind of like the Alaska Airlines cautionary tale. A local fitness center that I go to advertised their superior air quality. It was kind of a pillar of what made them stand out, which is cool. But being that guy, again, I brought a CO2 monitor in to one of the classes because I was curious, and I found that they're hitting 3,600 parts per million of CO2. For mental reference, outside is about 420-ish. So 3,600 is very high. At that level, 9% of the air in my lungs came out of somebody else, which if you thought about it in terms of drinking a beer, would you drink a beer that was 9% somebody else's backwash? No, it's gross, right? So same kind of thing with air, as it turns out. It turns out their ventilation system had malfunctioned. They just had no idea. I mean, how would they? It's invisible, right? And that really got me thinking: as how do you know if somewhere is safe? I mean, people in good faith tell you things, but it's not necessarily true, not because they mean ill, but just because they don't really know. So I kept coming back to that problem, and my conclusion is that one of the big issues in the pandemic has been that airborne disease is invisible. You can't see it or smell it or taste it. I think if we could have seen it floating around, like a red fog around us, I think it would have played out very differently. But as it is, you can't see viruses, and so you can't avoid them. You might even be skeptical of their existence. So there's no way to tell if you're being exposed or not. You're flying blind, you're making decisions with little or no data. And if you have been exposed by the time you find out, it's too late, which, especially if you're part of that 5% who are medically vulnerable, you're living in a state of constant anxiety. So our solution at Airhounds is to make that invisible fog of disease visible. And we do that by measuring CO2 with a wearable sensor. And we use the CO2 as a proxy for aerosols that can carry airborne disease. We send the CO2 measurements to our mobile app, and we use the CO2 level to calculate a risk score. And so this is tied to a CO2 monitor in my house right here, and it's telling me that my risk is low, which is actually especially true because I'm not going to infect myself, right? But if you were in public, then it would potentially be a different story. And so the risk of infection is presented as a simple stoplight. Green is go, enjoy yourself. Yellow means you should take precautions like opening window or wearing a mask. And if you're in the red, you should probably go somewhere else that has better ventilation. Behind the stoplight model is a scientific model developed at the University of Colorado Boulder, which takes into account activity level, immunity rates, and community spread. So the way it works is really simple. You just wear it, pair it, and share it to get CO2 level. We're developing a small wearable sensor. This is a prototype that is coming together nicely. I need to fab up a 3D case for it, but it's getting there. The sensor pairs with our mobile app. The app calculates a risk score and sends measurements to a shared map. The map makes it easy for everyone to see their risk, kind of like Yelp for indoor air quality. We should have prototypes of the sensor in hand this summer. In the meantime, we're using these AirNet 4 sensors just for our development purposes and also as a service that we offer. An early version of the app is awaiting approval by the Apple Store. And with the help of an intern from the University of Alaska this summer, we should have a version of the map up and running by fall. So I think the long take or the short take of all that is that by the end of summer, we should have a fairly good triad going with all the bits and pieces talking together. And when I say we, I mean me and my son, Max. I'm an MIT graduate with 3 years of experience designing, implementing, and operating complex systems. I've built X-ray telescopes for MIT, designed supercomputer motherboards, and architected document management systems for Alaska's largest oil companies. Prior to leaving my day job at GCI to focus on Airhounds this last October, I was a senior IT manager leading a group of DevOps engineers. Max is a software engineer at Alaska's Premier Telecom, where he has served as product owner and scrum master, mentoring a team of software engineers. Max is proficient in more than a dozen languages and frameworks. And as an adjunct professor at the University of Alaska, he has taught complex systems analysis and agent-based modeling and life sciences. I have to say, even though he is my kid, the guy is basically brilliant, and I couldn't do this without him. I'm too old. My brain isn't as good as it used to be. But Max fills in for me admirably there. So he's my guy. Normally in my pitch, this is where I would ask for money because that's a thing. But today I'm going to make an offer instead. And the offer is one of collective action. As it turns out, Airhounds gets a whopping discount on AirNet 4 CO2 monitors. And we can pass that along to up to 10 people at a 20% discount. So it takes it down. If you go to Amazon right now and look for AirNet 4, you're going to probably see it running at $249 and change. We can get it to you for $200 along with early access to the Airhounds app so that you can actually see risk calculations Because of some gyrations in how we publish that app out to you, there's a limited time sign up there by May of by the end of this month. And that sign up is visible at airhounds.eco/blog here. And so please hop on board. These things are solid units. They're great for inside installations. If you want to just hang it on the wall of your business or whatever, it's going to run. If you do measurement intervals every 10 minutes, it's going to run like 4 years or something goofy on 2 AA batteries. It's really quite nice. Talks by Bluetooth to your phone or your tablet or whatever if you want to echo the CO2 readings, or to our app, as it turns out. So they're just wonderful little widgets, and I highly encourage you to get in on this if you want to have a way to actually see what the air quality around you is. So that's one thing. The other thing is that we are planning a group build of Corsey Rosenthal filter boxes. Like I said before, I put a couple of these together, and I can vouch for their simplicity and effectiveness. It's duct tape and MERV 13s from Lowe's and a box fan and a couple pieces of cardboard. It is as simple as it gets, but it's remarkably effective. We'll source materials for you at cost and lead you through the process of putting it together. If we have to rent an appropriately well-ventilated venue, we'll ask you to chip in an additional account to cover that, but that's TBD, still working on the details. We'll add a sign up for that at our blog in a few days, so check back on that. And in the meantime, we do offer CO2 spot check and monitoring services primarily for local businesses. So if you had a need, if you were curious to how your air quality is, then we can actually sort that out. And if the data warranted having a longer term monitoring solution in place, we can do that too. So you could have between 1 and up 8-ish, depending on the size of your facility, CO2 monitors, and either reporting into a tablet in the simple case or going up to the cloud if you needed a more comprehensive solution. So that's what we can do for you now. But I do want to put this out that it's just, sometimes I get a sense of helplessness around the pandemic, because it feels like we've just kind of thrown up our hands and said, well, it is what it is, and we're just going to have to learn to live with it. And I mean, as kind of an engineer type, I'm like, well, learning to live with it means something different to me. Does that mean actually figuring out how to dodge those bullets to the best of my ability? And so, yeah, so we want to help. If you're into any of that, then hit us up, please. That's all I got.
Awesome. Doug, thank you. Can I ask everybody to either virtually or if you're visible to give Doug a round of applause? That was fantastic. So one of the things that I really love to highlight is that Doug is the epitome of a health tie entrepreneur. This is somebody who wants to give back to the community, who's using his expertise in order to make the health and the health care of those around him better. So I'd just like to say thank you for doing that, Doug. Many people talk about these things, very few actually do something about it. So you're just an absolute hero in my view. Thank you for this offer. I've already signed up and signed up other people. So I think 8 other people better be fast before that fills up, that offer. What I'd like to do, you offered a few times in your presentation for people to stop and ask you questions, but I think we're also attuned to kind of waiting till the end. I always have questions, but can I ask if there's any from the audience? Is there anybody that would like to talk to Doug about his technology and maybe his development of this idea and where he's going forward? And Doug, maybe you can take down your presentation just so that we can see.
Sure, absolutely.
Oh, awesome.
Hi.
Yes, hello. Are there any questions from the audience?
I see that Jared was calling out that Costco is selling 3 packs of air filters. The ones that work best with your typical box fan are the 21-inch squares, and it was at one point in time Lowe's had those on sale. You can get a 4-pack for, I think it was $66 or something like that. It was fairly steeply discounted. I think it was 20% off for what it's worth. I don't know if that deal is still on, but yeah, I mean, they go up for sale pretty cheap.
So let's get those. I see that Becky has a question. Becky, do you want to unmute and ask a question?
Yeah, thanks, Jacqueline. Doug, how many folks are going to be doing the testing for the mobile device? What are the date parameters and how many people are testing?
Yeah, great question. We're planning on having a larger run of prototypes available. So let me just walk the process. The process is, this has got to get from my workbench to some sort of thing I can give people that won't break when they touch it, right? And we think that's going to be towards fall. And we're looking at some companies down in the lower 48, Cyber City circuits or Sunstone circuits. There's a few different places that'll do the assembly for us and get that all kitted up. And so in the fall timeframe, we hope to have a limited number of prototypes that we can hand out for testing. And of course, we don't, I understand how precious people's time is, right? And that, messing around with any kind of new technology can be both rewarding and frustrating. And so, I do not have a group of testers selected at this point in time, but I am absolutely looking for them, Becky. And so if you want to be part of that group, I would love for that to be so.
I know someone who might be interested, a college student and with a invisible, I guess, health disability who can't be vaccinated, but is going back to in-person classes.
Scary, yeah.
Yeah, and so is that something you would consider?
Yeah, absolutely. Absolutely.
Okay. All right, I'll probably be in touch with you after the meeting.
Please, yeah.
Awesome. So I think Becky brings up a really good point, and you alluded to it, Doug, that there's many people who are being left behind, who are anxious, who have health conditions that are not allowing them to just cross their fingers and just hope for the best. So are you reaching out to those communities, Doug, or since this group is often connected to them, what can we do to assist you with that?
That is such a good call out. It is really a gap in our whole how to reach the market plan. I've done some customer discovery sessions, and after those, I discovered that my intuition about who would be interested was largely correct, but I couldn't define what that intuition was. So the idea of targeting that 5% vulnerable group specifically is very attractive. And no, I do not have, other than my daughter whose lungs were scarred by a fluorine release, I do not have any significant contacts yet into that community. So if people do, I mean, Becky was mentioning, the college student that she knows, but those folks I would love to talk to and come to a better understanding of what their issues are.
Awesome. I think I can definitely provide some introductions there for you. Are there any other questions, Vern? Have you? Yes, please.
What's the square footage or the size? If you build one of these boxes, is it good for a warehouse, or do you need like 4 of them for a warehouse? Great question. It is a volume equation, right? So it's a throughput problem. I can get those numbers to you. I don't have them loaded into my head. Anecdotally, I can tell you that I took one of these boxes and I put it into a 3-bedroom apartment where one of the occupants was sick with COVID, symptomatically sick and infectious, and 2 others weren't, and they never got sick, which I thought was pretty cool. Of course, there's all sorts of uncontrolled variables there, but if you have a sense of the volumes, or if you want me to give you like the volume per box, then I can absolutely get that back to you, Vern. I can do that math. Thank you, sir.
Yeah.
Awesome. And Vern, what I said in the chat is if you want to put your contact information in the chat, then I'll make sure that you and Doug are connected. So I'm going to plan on just hanging out. I know we typically end our presentations at 1:30, but we're certainly here to try to make sure that people who are interested get more information or get connected with Doug. Are there any last minute questions at all?
Hi, Doug. I have a question.
Yes, please.
Hi, everyone. So I was curious, do you think maybe collaborating with doctors or like someone in the healthcare system could provide an insight on, like your target market, so that 5%. And I know, for example, like for other type of services, a doctor will say, hey, like you could check out this other, support network, or get this product, or go get a specialist, and get an appointment with them, and so on and so forth. So I wonder if that might be somewhere that that could be a partnership.
Yeah, I love that idea. I don't have many doctors in my personal network, and at some point I was talking to Laura Oden and Ayla Rogers out of Pandare Shoes, and they kind of had a similar comment. It's like, find the gatekeepers, and they said, in your case, the gatekeepers are probably doctors, right? I'm like, well, that makes sense. The only folks I've talked to in the medical profession so far have said something to the effect of, well, Doug, we're a very evidence-based group, and until you have evidence that your widget works, we're probably going to be loath to recommend it to any of our patients. And I'm like, well, fair point, but that's I have very few data points, Evelyn. So talking to doctors as part of customer discovery kind of activity would be super helpful. I'd love to, if you have some that I could ping.
Yeah, I'm gonna think about it. I'll reach out to you by email.
Okay.
Awesome. And I see Vern, and actually Vern has put his contact in, so I know he's with Access Alaska. So that is awesome. So connection made. Vern, did you have another question?
Is the recording available so I can show other people?
Absolutely. It will be by tomorrow, and I can share it with you.
Okay, thank you.
And I am trying to find Vern's address
I think he sent it to me, but I'll share it with you, Doug.
Okay, cool. Yeah,
Okay.
yeah. And I can reference the recording as well if you get to pull off people's addresses. So.
You sure can. You sure can. So with that, I'm going to say a huge thank you to Doug. And Vern, it's so wonderful to have you here. This is exactly why Health Tie exists, is to make these connections and highlight the good work of change makers. Yeah, thank you, Demetrius. And so really excited. And we do something called the Director's Minute. It always feels like we're rushed. I just want to highlight, there's another change maker that maybe Vern and others want to know about. It's a woman who started a business called Far North Health Services, and she's a physical therapist who has now created a mobile unit in Anchorage that's going directly to people's homes to provide physical, dietary, and speech therapy. So she works a lot with seniors, but she also works with the disability community. And so she will present probably in September. That's a long time to wait. And so I want to make sure that people know about her now. So awesome. And and also I really want to highlight, Melanie, thank you so much for helping me remember. The Alaska Angel Conference is next week, and it looks like if Doug attends, there might be a People's Choice Award that he could win. That would be super beneficial, a free tax award. So
money is a thing, I'm just saying.
It really is. So with that, if anybody if I've forgotten anything, if there's other things, I just want to do a shout out to Julie. She did a fantastic 1 million cups on Wednesday with Alaska Natural Burials. That was awesome. And I really appreciate the community generally. I think we really have a nice, just creative community that's coming together. Thank you again, Doug, for your presentation, and thank you all for attending. I will see you in 2 weeks. We're actually going to have somebody present from Canada, and he has a business called Anuka Health that is also doing virtual, it's actually pain management done virtually. So that'll be really interesting. Please join us again in 2 weeks. So thank you all, and I hope you have a fabulous afternoon.